Hi everyone, happy Naturopathic Medicine Week. Today I want to talk about one of the core concepts of naturopathic medicine. So if you are already familiar with naturopathic medicine, maybe you follow my blog, follow me here, follow me on Instagram, then you're probably already familiar with some of these key foundational principles that we found naturopathic medicine on that really dictate how we practice, and they really explain and display what the medicine means and what it's based on. So some of these core concepts are the foundations of health or the determinants of health. Determinants of health are not specific to naturopathic medicine, so you'll see many other types of medicine and public health referring to the determinants of health or the foundations of health. And these are things like basic lifestyle factors that you might think of. So diet, exercise, having clean water, clean air, having places to play and have recreational activities, having a good social network, having access to supermarkets and reasonable prices. Those are all what we would consider foundations of health or determinants of health. Another key factor in naturopathic medicine is what we call our naturopathic principles. Those could be a discussion for another time. There's so much to go through with each one of those 6 principles, and they're really what our medicine is founded on. But today what I want to talk about is the therapeutic order. So therapeutic order and the naturopathic principles are, as far as I know, specific to naturopathic medicine. So these really define what this profession is. I know it's kind of a almost like an unknown area in medicine in general, at least in the United States. People hear naturopathic medicine and they're not really sure exactly what that means or what naturopathic doctors do or what they might expect in a naturopathic appointment. If you're curious at all, definitely explore more about, again, these principles of naturopathic medicine and the therapeutic order. So I've mentioned both these things in previous videos, and in those previous videos as well, I said there's so much more we could dive into around each one. Again, today we're going to focus on the therapeutic order. I am not tech savvy when it comes to filming these videos, so I'm not yet sure how to post a picture on the screen as I'm talking. So what I'll do is I'll post a link in the description box below underneath this video. So if you click on that website, you will find a picture of the therapeutic order. If you want to, just pause this video here, open up that link, and then you can follow along as we go through. But I'm just going to give you a quick overview of each one of the tiers of our therapeutic order. So having this therapeutic order as a naturopathic doctor really guides the way that we treat patients. Not very often that you'll see moving through these different progressions of the therapeutic order in one visit. These are ways to approach the healing process, usually over time, over a number of visits, a number of months, but they really just form the foundation and the direction of our treatments. So at the bottom of this pyramid, and the way that this pyramid works, this therapeutic order pyramid, if you're looking at the picture, you'll see that it's a triangle. And so we start from the bottom and we work our way up if necessary. So at the bottom, you'll see the most foundational items, the things that are usually the least expensive, the least invasive, and yet they still, in many instances, have a very high potential to turn a case around and really have profound positive impacts on health. So again, we start at the bottom of the triangle and we work our way up if needed. So at the very bottom of that therapeutic order, the first rung, if you will, of that therapeutic order triangle is to establish the foundation for optimal health. And so if you're looking at this image, if you're looking at the image that I'm looking at this moment, you'll see that underneath this title for the first tier, it says this is identifying and removing the obstacles to cure and assessing the determinants of health. So essentially, this is going back to what I mentioned previously. We're looking at the foundations here. diet, sleep, exercise, stress. We're really looking to see how do we fit in each one of these categories. Are we hitting all the nutrients that we are trying to intake? Are we getting enough water? Are we getting enough sleep? So we're really, again, looking at the basics and the foundations when we are at that first rung, which again is establishing the foundations for optimal health. This also includes removing obstacles to cure. So this is another important facet of what we do as naturopathic doctors. We look for sort of like the hang-ups, if you will. Where is someone really having a hard time in their journey back toward health? And what can we do to remove that obstacle? So this is the first tier of the therapeutic order. Then, if we need to, if addressing that first level does not rectify the problem, then we're going to move up the triangle to the next tier, which is to stimulate the self-healing mechanisms. In other words, recognize the healing power of nature. So one of our 6 principles of naturopathic medicine is the healing power of nature, which recognizes that our bodies have an innate healing ability. Nature follows natural laws, which our bodies also abide by. And if we live in congruence with those laws, then we are much more in a position where our bodies will naturally find health. So health is, in naturopathic medicine, understood to be our inherent natural state. It's just when these outside stressors are pushing us away from that balance that we find dis-ease or ill health. So when necessary, if the foundations of health and getting those in place and removing obstacles to cure, if and when that's not enough, and we move up to stimulating the self-healing mechanisms and stimulating that healing power of nature, this can include, in the naturopathic world, methods like homeopathy or constitutional hydrotherapy. So these are giving that vital force, we call it in naturopathic medicine, which is that innate force of healing, giving it a little nudge in the right direction toward healing. So that's stimulating the self-healing mechanisms, or the second level of the therapeutic order. Third level, if that's not enough, is to support and restore weakened systems. In other words, aid the regeneration of damaged organs. So when we're talking about weakened systems, even though in naturopathic medicine we recognize and understand that the body is one organism, it's one whole, and all the systems are interconnected and play a role in the health of each other, and then of course the health of the whole, there are also times when certain organ systems are either prone to weakness congenitally or have developed a weakness. And so in this case, we will target those weakened organs or organ systems, and we will do what we can to boost the health of those organ systems, which will then, of course, boost the health of the whole organism. So that's supporting and restoring weakened systems. If you're having trouble visualizing this one or getting an idea of what it means, think of someone who's constantly getting colds. Every time the weather changes or every time we go through cold and flu season, they have 3 or 4 rounds of an upper respiratory infection. So we might say in that case that the respiratory system, or the lungs, are possibly a weakened organ system that we might want to focus on strengthening and tonifying in order to overall boost the health of that whole person. The next phase, and the fourth from the bottom on that therapeutic order triangle, is addressing physical alignment. In other words, restoring proper structural integrity. So when you think of this one, think of what might happen when you go to a chiropractor's office. You usually will get your whole spine adjusted top to bottom so that everything is aligned. So when we're talking about that physical alignment, we're talking about having the bones of the spine in place, the bones of all the extremities, and then when that backbone, literally, when the bony structure of the body is in place, it gives nerves their free space to flow. When the nerves leave the spinal column, they come out through little holes in in the bones between each vertebral segment. And so when we're in proper alignment in terms of our spines, we give those nerves the optimal outlet so that they can send information out from our brain and spinal cord to the rest of our body and also take information in. Our muscles are also affected when our bones are in place versus out of place. So starting with the backbone is almost like starting with the foundations for health. We're getting that system in alignment so that everything that flows out from it and actually in and out can be in good working order. So physical alignment, picture what's happening at your chiropractor's office. Also note though that many naturopathic doctors in states in which that's part of our scope can actually do what's called a grade 5 adjustment, which is like the adjustment that you would get when you go to your chiropractor's office. So if you see a naturopathic doctor, be sure to ask whether grade 5 adjustments are within that ND scope and if they practice that, because you could potentially get multiple visits done in one visit with your naturopathic doctor. So the next tier of the therapeutic order triangle is natural symptom control, in other words, using natural substances to palliate. So this is what I think many people think naturopathic medicine is. I think there's an understanding, which is a misunderstanding, that naturopathic medicine is like green allopathic medicine. In other words, instead of using, for example, a pharmaceutical diuretic to lower blood pressure, you might use an herbal diuretic to lower blood pressure. But you're not, in this case, you're not looking at the root cause and trying to address the root cause. You're not asking, why is this patient having blood pressure? You're just looking for a more natural way to help treat the symptom. So this is not naturopathic medicine at its root. This is, as you can see, the 5th tier up from the bottom, so it's definitely not our first line therapy. But when necessary, we will prefer to use natural substances when appropriate over pharmaceutical substances for palliative care. Palliative means reducing symptoms. Next step up, and we're almost at the top now, we're one step away from the top, is synthetic system relief, which is use of drugs to palliate. So this is, again, literally one step above our last tier, where instead of using a natural substance to address the symptom, we're now using a pharmaceutical substance to address the symptom. And then finally, at the very top, we have high force interventions. So these include things like surgery, very strong drugs that will suppress usually entire systems, things like steroids, immune suppressants, for example. These in naturopathic medicine are pretty much our last resort. We don't generally, as a whole and as a profession, we don't believe in suppression of symptoms unless it's completely necessary. Usually this means in life or death situations. So the way that naturopathic doctors view suppression is that if you see a patient with a symptom and you're not asking why does this patient have the symptom, but instead you're putting something over that symptom to cover it up, our philosophy of the body and the way that healing and disease works is that if you have something a little bit further on the surface, you have something superficial maybe, and you suppress it, what you're doing in the naturopathic view is you're pushing it deeper inside the organism. So a classic example that we have, a lot of times if children have chronic eczema and they're using a lot of topical steroid creams to treat that eczema, often later in life, what you'll see is these individuals go on to develop asthma. And so that would be an example of a more superficial illness that was suppressed instead of gotten to the root cause of, and then pushed deeper into the organism to a more vital organ system. So this is why as naturopathic doctors, we try not to suppress unless it's completely necessary. This is also why then, of course, this is the highest tier on our therapeutic order. It's essentially our last-ditch effort if all else fails. But naturopathic medicine is so powerful the body and nature and that healing wisdom is so powerful that if you get the bottom tiers in place, it's rare that you'll need to go all the way up to the top. So I hope this was helpful. I hope you learned a little bit about not just the therapeutic order, but naturopathic medicine as a whole and our approach toward healing. Again, definitely make sure if you haven't checked out that website in the description below with the image of this therapeutic order triangle, that you do that after this video, because it'll really, I think, cement it in place for you and make it a lot more clear what I've been talking through this whole time. So again, hope this was helpful. If you have questions, always feel free to reach out, leave a comment, and if you like what you see on the channel, then subscribe. We'll see you next time on Dr. Heather ND.